Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Kindly like, subscribe, and share for more. Ever wondered why a sudden jolt or twist can cause tremendous pain in your joints? Well, the answer could be subluxation or dislocation. Subluxation is a partial dislocation where your joint doesn't move as it should, while dislocation is a severe injury that happens when the ends of your bones are forced from their normal positions. A specific type of subluxation, known as the subluxation of the head of the radius, occurs in the elbow joint. Understanding these conditions starts with knowing their causes. So, what causes these painful joint conditions? Well, a variety of factors can lead to subluxation and dislocation of joints. One of the most common causes is trauma. This can be a result of a car accident, a hard fall, or any sudden impact that forces the joint out of its normal position. Sports injuries are another frequent culprit. High-impact and extreme sports can cause the joints to move beyond their normal range of motion, resulting in subluxation or dislocation. Congenital defects, or conditions present at birth, can also lead to these joint problems. Some people may be born with unusually shallow joint sockets or loose ligaments, which can make the joints more prone to subluxation and dislocation. Interestingly, subluxation of the head of the radius, a bone in the forearm, is often caused by a sudden pull on the arm. This is particularly common in children. Now that we know what causes these conditions, let's explore the signs and symptoms. What signs should you look out for? Well, signs and symptoms of subluxation and dislocation are usually quite noticeable. One of the most common is severe pain. This pain often occurs immediately after the injury and can be quite intense. Next, there might be visible deformity. The joint may look out of place or oddly shaped, especially when compared to the unaffected side. Swelling is another telltale sign. The body's response to injury is to rush blood and fluid to the site, causing the area to swell. Then, there's the inability to move the joint. You might find it hard to bend, straighten, or use the joint in any way. This can be particularly noticeable in subluxation of the head of the radius, a condition that often presents as an unwillingness to use the arm. Recognizing these signs and symptoms is the first step towards diagnosis. So, always be vigilant and take action if you notice any of these signs. How are these conditions diagnosed and treated? Well, the first step in diagnosing subluxation or dislocation involves a physical examination. Doctors look for signs of injury, tenderness, and a limited range of motion. But for a more detailed look, imaging studies like X-rays or MRIs might be required. Once diagnosed, treatment varies based on the severity and location of the condition. Reduction, or manually relocating the joint, is often the first line of action. In some cases, the joint might need to be immobilized for a period to allow tissues to heal. This is often achieved with splints, casts, or braces. For more complex or recurring conditions, surgery might be necessary. Specific to subluxation of the head of the radius, a specialized maneuver called a reduction maneuver is often employed. This involves a careful and strategic movement to relocate the joint. Treatment is vital, but it's just as important to be aware of potential complications. What could happen if these conditions aren't treated properly? And how can we prevent them? Untreated subluxation and dislocation of joints can lead to an array of complications. Chronic instability is one such complication. This means your joints may become persistently loose and prone to recurrent dislocations. Over time, this can severely impact your mobility and overall quality of life. Another complication is arthritis, a condition characterized by painful inflammation and stiffness of the joints. When a joint is dislocated or subluxated, the cartilage can be damaged, causing premature wear and tear. This can eventually lead to osteoarthritis, a degenerative joint disease that can be debilitating. Nerve damage is also a serious concern. The nerves around your joints can be stretched or compressed during a dislocation, which can potentially cause numbness, weakness, or even paralysis in the affected area. Now, let's pivot to prevention. One of the best ways to prevent joint subluxation and dislocation is by wearing appropriate protective gear during sports or any physical activities that put your joints at risk. This includes helmets, knee pads, elbow pads, and wrist guards. Avoiding high-risk activities is also crucial. If you've previously experienced a joint dislocation, be mindful of your movements to avoid a recurrence. Regular strength and stability exercises can also help keep your muscles strong and your joints stable. Remember, prevention is always better than cure. Stay safe and keep your joints healthy. UMCC, your ultimate medical consultants connectors.